certified diagnostician with a double specialty of infectious disease and nephrology. I'm also the only doctor currently employed at this clinic who's forced to be here against his will. That is true, isn't it? But not to worry, because for most of you, this job could be done by a monkey with a bottle of Motrin.
Okay, so no. I think internal medicine or outpatient medicine is actually really hard. You definitely have to have good relations with your patients. It depends. It depends on your bedside manner. And it depends if you like a slow process, like to make patients better in a slower way. Some people need a more fast-paced environment, like my ER friends. So it really just depends on the type of personality you are and also the type of doctor you are.
Speaking of which, if you're particularly annoying, you may see me reach for this. This is Vicodin. It's mine. You can't have it. And no, I do not have a pain management problem. I have a pain problem. But who knows? Maybe I'm wrong. Maybe I'm too stoned to tell. So, who wants me?
Okay, so also I probably wouldn't do that. You can choose to tell your patients your medical conditions if I guess you think it would help. But yeah, you probably wouldn't do it like that.
Okay, well, I'll be in exam room 1 if you change your mind.
Sorry, my head's killing me.
You spent a week doing top of head in anatomy. I know just where it is.
Ow! That's not the top of my head.
Close enough for clinic.
Okay, so also, yeah, you probably don't want to be touching patients without warning them. Could be considered assault, so I would lay off on that.
Your sinuses are clogged. Judging by the scratches on your hands, I'm guessing a new cat.
Yeah, it was my mother's. She's dead.
Did you keep a dead cat?
No, my mother's dead.
Oh. Poor cat. You're allergic. We can control it with antihistamine. 1 pill a day.
Pills?
You don't like to swallow. Not surprised. Forget the pills. I'll give you a nasal spray.
I'm not going to comment on that comment. We're just going to keep watching.
Great.
Steroids? Is there something else you can give me?
Well, if you live by the river, I've got a bag.
Okay, so although he is being extremely rude, it's actually surprising how many patients come in with asthma symptoms, come in with sniffles, congestion, and don't want to get rid of their cats or their pets, and then they also don't want to take medication. So this is an actual problem that does happen in the clinic, and you have to find solutions for this. And then if the symptoms are okay, you can kind of work around it, but if it's really bad, in the end, you might have to get rid of the cat. One thing you can do is send the patient to an allergist, and they can try to, essentially try to make you unallergic to your animal. But that does take a couple of years, so it's not a quick process.
Can I help you this beautiful morning?
I told the nurse I have a runny nose, but I don't. I think I have syphilis or gonorrhea.
I think I have an STD.
Also, this happens more often than you think it would. And they taught us in medical school, it's like the last thing the patient will mention before you're done. It's true, you wrap up everything and they're like, oh, can I be tested for a plethora of things? The thing is just to try to be understanding, know that it's probably pretty hard for the patient to bring this up. And you just definitely try to be sympathetic and run the tests that need to be run.
I think I have a...
Also, yeah, you would also think that it's always the young patients coming in and they have STDs. Also not true. It can happen to anybody. I've seen all types of patients, so you can't really judge and you kind of have to expect the unexpected. Wear gloves. Always wear gloves.
Margins are fine. Little lesions. Color is good. How long have you been having night terrors?
3 weeks. He's afraid to go to bed. He's exhausted, can barely function.
What does that tell you?
Nothing. It's just fun watching him blink. Name as many animals as you can that begin with the letter B. Go.
Baby elephant.
Baby elephant is actually a good answer. B is a bear of a letter.
What does that tell you?
Prove it.
Yeah, also, some patients just mentate differently. You just have to deal with it.
Sore throat. Let's stop lupus. Well, not everyone can operate a zipper. The up, the down. What comes next?
My new girlfriend. Never been with a guy who wasn't circumcised.
Okay. In actual reality, I would send this patient straight to the ER. I'm not an ER doctor. I'm not equipped for that. So to me, you have to know when you have an emergency and you just take care of that really quickly. Great thing in my clinic, the ER is literally half a block. So yeah, that would be an emergency call to the ER.
So she free.
You wanted Rivka to feel.
Okay. Also, you have to be prepared to be surprised by patients and not react like that. I would try to keep my best poker face. Still wearing a mask in the clinic, so you probably wouldn't see me react like that. I'll just keep it in my head.
I got some box cutters and
Just like Abraham did it.
I sterilized them, which I was told you to stop talking.
I'm gonna get a plastic surgeon. Get the Twinkie back in the rubber.
I would also get a plastic surgeon, but I would send them to the ER first.
How old are you?
30.
You've never seen an after-school special? Dawson's Creek. And you get to 30 and not know about condoms.
Oh, God, I have an STD.
No.
People don't use condoms enough. That's all I have to say as a doctor. Not enough, not as frequently as enough. People will say they use condoms, then you're like, you just question it, really? And then they're like, well, not all the time. And I say, really? And then they say, almost never. So sometimes as a doctor, you have to take a deeper dive. You can't just believe everything on a surface level. And you're just trying to help the patient. So questioning them to get to an answer, I think is definitely appropriate.
But you will. You're lying. That's not the point. You've never seen Dawson's Creek. And you've never seen an after-school special. How do you live to your age and not know about condoms?
She has menstrual problems. They're really bad. The patients are in bed all day. Plus, she's super depressed.
She said super depressed.
She heard that birth control pills can make her feel better.
She wants birth control pills for her PMS.
I guess.
Judging by the redness around your mom's nostrils and the tissue she's got conveniently stashed in her wristband, I'd say her problem is more likely a URI than a PMS.
URI?
Of a respiratory infection. A cold.
I don't think so.
I also think she's got a problem with SAC.
SAC?
Thanks for playing stupid American child. If you want the pill, all you have to do is to walk into any health clinic in Jersey alone and ask for it.
Okay, so I'm trying to extrapolate what's the good information in this. It does happen now and then that patients will come into the clinic and they are translating for their mother or something like that. And although they can be helpful, you usually want to get an official translator so nothing's lost in translation. So if there was anything I would take from this clip, it's that you want to make sure that the communication between you and the actual patient is direct and precise.
No.
Leave here right now.
House. You can't.
My money. And he doesn't even.
My
asthma. They said they'd fix it, but it didn't make any difference at all.
Well, sometimes doctors make mistakes. Anna, you need to try twice as hard to fix them. Are you using your inhaler?
All the time. Go through one a week.
You sure you're using it right?
Do I look like an idiot?
No. Why don't you show me how your inhaler works?
Okay, so this has not happened to me, but it's definitely happened to colleagues of mine. People just don't know how to use their medication properly. This is one of my favorite house clips of all time. I think every med student at the time this came out just kind of was aware. Anytime patient says a medication is not working for them, I always ask them when they take it. Are they taking it at the right time? Are they taking it at the appropriate dose? Who prescribed it? All that kind of stuff. You can't just assume that there's something wrong with the medication first. You kind of take them through the basics and then work up to what all the problems could be with the administration of said medication. I would probably also smile like